Hi, good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With me today are Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is the Director of Epidemiology. And Allison, thank you for being here as our ASL interpreter. Dr. Ariola, I thought maybe a good place to start was just talking about updates for the week and maybe an update on the doses we were waiting for because of the weather delay.
Thank you, Jody. Good afternoon, everyone. Always a pleasure to provide updates to our residents. And I'll start with the last one that you mentioned. Because of the weather that was pretty harsh across the region, we did not get our supply last week. The good news, though, is it's not disruptive in any way. We had on hand our second doses that are planned for our clinics for tomorrow and for Wednesday. We had about 1,100 to run our clinic on Thursday, but the good news is we did receive a shipment today. So we're covered for the rest of Thursday and covered for our clinic on Friday. Our partners are covered for their clinics. Some of them, not every one of them, is able to get doses this week because we are focusing on the 80 plus, and then also covered for our clinic for next week, Tuesday. So we're good. Vaccines, some came in today, and Elizabeth will come in later to provide additional update. Over the weekend, we received a word from the state that they were going to provide additional vaccine for us to focus on our educator category. You will remember that last week we mentioned that they were going to send 2 trays, which is equivalent of about 2,200 doses. In addition to that, they're sending 3 trays, which is about slightly over 3,300 doses for first dose and a corresponding 3 trays for the second dose. So really, really good news, and Elizabeth will get into the details of what that means in terms of vaccinating in our educator category. For us, it means that the doses that we are receiving otherwise are going to go into our 65 plus category and some to our childcare providers, but we do not have to provide vaccines to educators. So we love the focus by the White House on our educators. We love the focus by Governor Kelly on our educators. That's very consistent with what we have been doing, which is over the past 1 year is a focus on our schools. We want our schools to stay open, want our childcare centers to stay open. And I think we've done that pretty well. And one of the development that I do want people to be to talk about slightly, and we'll provide more information tomorrow, is we do know that some of our schools are already planning to reopen, and Elizabeth and her team are working on some additional details that we need. But I think bottom line for us is we are going to be supportive of those efforts. Obviously, the appropriate mitigation measures have to be in place. And of course, we have to have some changes or improvements to our contact tracing and other non-pharmaceutical public health information, but we'll be providing more details about that later in the week. This week, we have a second dose clinic for our 80 plus ready tomorrow and Wednesday. You recollect that about a week ago, on Tuesday last week, because of the weather, we had to cancel our clinic. And so we moved all those that were scheduled last Tuesday to this week's Wednesday. So if you had an appointment last week Tuesday, this Wednesday, February 24th, at Oakland Fieldhouse, at the same time that you're on your appointment card is when you need to show up. We will be there to vaccinate you, and so that we can really move through our 80 plus category. We chose to focus our clinics on Thursday, Friday this week, as well as Tuesday next week on our 80 plus category. And most of those, we opened that up last week, Friday, Friday morning, I think. And we sent all the appointments to everyone that is on our list that have completed our online vaccine interest survey as at Friday. Now, over the weekend, a few other people signed up, and we've also sent those out to them. And quite a few of our partners, commissioners have sent additional names when you have reached out to them. So if you are on our list and you are 80 plus, you should have received information about how to book an appointment for that group. So after the clinic next week, Tuesday, we feel like we will have sent and given everyone on our list that has shown interest, that's 80 plus, opportunity to sign up. Now, to clarify, if you are one of those that have indicated that you need help with transportation, or one of those that we need to take vaccination, bring vaccination to you, I'm not really talking about you. We're going to contact you and address those separately. We are finalizing those logistics. Other than that, after the Tuesday, we are going to move our clinics to 65 plus. I want to emphasize that. After the Tuesday, our clinic will be 65 plus. We understand that there may still be a few 80 plus there. We're going to walk you into our regular clinics. But as of now, we have sent opportunities to register, to book an appointment to every 80 plus on our list. If you're on the list and you have not received an appointment, reach out to us, jcdhe@jocogov.org, or call us 913-715-2819. So after next week's Tuesday, our appointments will open up to people that are 65 plus, and we have received a ton of emails and phone calls about when do I qualify. So our clinics moving forward for the next few weeks will focus on those that are 65 plus, and we are going to continue to walk in as many 80 plus as we can get, the ones that remain. Now, the question that people ask us is, how do I know when I will be called? Remember that we are vaccinating our partners, our health systems, and other partners are also vaccinating. We know that this past week, we vaccinated, and several of them also vaccinated a few thousands of people in that group. In our case, we're going to be walking down that list. We are going to send out opportunities to book an appointment to people based on the number of appointments that we have, which again is based on the number of vaccines that are available. And so for those that say, I'm not affiliated with the hospital, you will have the opportunity. Those that are affiliated with the hospital, that's great too. If your hospital has not called you, you have the opportunity with us. And in the chance that we have additional vaccines coming through the state, it increases your chance of getting an appointment as quickly as we can. So those, I think, are some of the updates. Last thing I want to say is that quite a few of our long-term care facilities have started to open up appointments for people to visit. And as you can tell, it's our most vulnerable group. And actually, we have worked with them and focused on them, maybe a shade slightly higher than our other groups that we focused on. They're very important. Vaccination has occurred in those facilities. There are new residents that are coming in that we have to ensure that they are vaccinated. And again, for those groups, for those entities that are opening up their facilities, we're saying do that with caution. Ensure that mitigation processes are in place, even though our numbers are down, and we're very happy that our numbers are down. For us, because hospitalization and death numbers are down, it does show, even with the decreased testing numbers, that there's a measure of a drop in community spread. No question about that. But the trajectory can change very, very quickly. That's why we continue to emphasize the fact that our public health order are important for them to stay in place. But if you are opening up your door to visitors, especially visitors that have not been vaccinated, understand that the risk is higher, especially since the vaccination rate among staff are not very high. And so we're not against that, but we do want you to understand that even though the risk might be reduced, the risk is still there, and that we're dealing with a very vulnerable population. So again, as we develop more of our testing plans for next week, Wednesday through Friday, which we're going to focus on 65 plus. Of course, anyone that that still need vaccination that's 80 plus, or anyone that's still part of phase one healthcare workers will walk them in. But because there's been a lot of questions around that, I do want to emphasize that beginning next week, Wednesday, clinics will open up to 65 plus. And the good news about the schools, I think it's really, really good news. I know I'm excited. Elizabeth is excited as our team, and I'll just let her speak to a little bit more about vaccination in our schools.
Thank you, Dr. Ariola. He's absolutely right. We were thrilled this weekend to get a call from KDHE. Children's Mercy had already been told that they would get 2 trays, and each tray has just under 1,200 doses in them. So they were told they were going to get 2 trays this week for K through 12 educators. And then over the weekend, we were informed that we would get 3 more trays for first doses. So that brings us to 5 full trays. So just under 6,000 doses for K through 12 administrator or K through 12 educators, which is in addition to the doses we have already given. And so in looking at what this is going to plan out for the next couple of weeks, we're going to do a K through 12 educator clinic this coming Saturday. And then next week, we are going to go ahead and do 2 additional K through 12 educator first dose clinics. And that's in addition to the second dose clinics we'll be running, as well as a childcare licensing clinic. So Children's Mercy is going to be exceptionally busy. It seems like nearly every day over the next couple of weeks, they will be doing clinics, but they are just as excited as we are to be able to get through the educators. It looks like really by the end of next week, at least for our K through 12, we will be close to 70% of our educators being immunized. And so at that point, we'll be looking to see how many we have left who want to take up the vaccine. So moving through quite a bit quicker, really as a consequence of the decisions of the federal government and Governor Kelly to prioritize this group. So we're thrilled, Children's Mercy is thrilled, and I know our schools are as well. And that will cover both public and private and parochial schools.
And, on that topic, I just happened to see a question. Someone was wondering why vaccinate educators before people who are 65 plus? What was the rationale for that approach?
Yeah, so if you remember back in the fall when a number of our school districts went full remote, particularly for their secondary students, the really big impetus for that was the fact that they didn't have enough subs to fill the teachers who were out either sick with COVID, or if they were quarantined because they'd been exposed. And so staffing is a really big piece for these school districts to be able to stay open and educate our children. So the idea behind vaccinating our teachers and our staff is that if they don't have to quarantine if they're exposed either through their personal life or at school, then we can continue to provide education for our students without having to go back and forth into remote more frequently. And so this not only benefits our students who we know can have mental health crises as a result of the stress and anxiety going around COVID or remote learning. But it also is really important for our population, our community as a whole, so that kids are in school, they're not, parents aren't having to figure out remote learning for them. And so it really is a benefit for students and our community at large.
And one more question kind of in that educator realm before we move on to some other questions. Somebody's wondering, is it the frontline teachers that are getting vaccinated before, let's say, the administrators or maybe the people that aren't as close to the students? Do we know how that's working?
So each school district and each private and parochial school are prioritizing their own staff, and that's a mixture. We had offered them several different options to prioritize, whether that was based on critical infrastructure. So, the environmental staff that you can't open school without, or the food staff, teachers certainly. We also recommended that they consider prioritizing based on age or on pre-existing conditions, sort of going along the same way that we do our phases for the population as a whole. And then some did it randomly or some combination thereof. So it is a combination of janitorial staff, food staff, bus drivers, teachers, administrators, secretaries, really across the board.
And to add to that, the KDHE ranking of the phases for educators and childcare providers covers not just the teaching staff, but administrators and custodians and bus driver, everyone that's needed to keep the operations of the school going. And like Elizabeth said, it has been a priority of ours to keep our schools open. For multiple reasons that include they're our future. We want them to not just enjoy the learning, the classroom instructions, but also the benefits of social interactions and all of those. And that's why we have put a lot of resources into keeping our schools open from the start. We enhance opportunities to test. We had hired part-time staff to assist them with the contact tracing. We had epidemiologists, Elizabeth's team. We had one epidemiologist per school district and several other staff that are assisting. And we meet weekly with the superintendents, very consistent with what we've been trying to do. So when the vaccines came in, it just moved us faster through what we're already working on. Keep in mind, last week, we announced that we've done about 37% we've vaccinated about 37% of people that indicated interest in our school. So this is just ramping it up. It's been high up on our priority list for a long time.
Some great progress. That's good to hear. We have some questions about our healthcare system partners. Someone has a very specific question or comment. They had heard that Menorah canceled this week's appointments because we didn't get the vaccines in. Do we have any updates on that?
Right. So we did not, and we had to make some tough decisions this week because we had a lot of persons remaining in our 80 plus category, and we have been trying to focus on that, and we have been pulling our numbers from our system, but also numbers from our public health system. When we open up appointments for the 80 plus group, they just tend to be taken up by younger people who do fit into that category. But it's not our focus in our clinic, making it very difficult to get appointments for the 80 plus. So we wanted to direct a lot of the resources for these 3 days to vaccinating in our 80 plus category. And those 3 days are Thursday, Friday, and then Tuesday the following week. And that's what we did. And that just meant that we did not have enough to spread around our health systems. But we hope that by next week, we'll make those available to them. And again, we've exchanged information with them. A lot of them are disappointed because they are ready to go. They're ready to increase their capacity. And so we continue to hope that we get more vaccines. And so again, by finishing these 3 categories, we'll open up and be consistent with the rest of the system. We'll be consistent and be doing the same thing as our health system, as our pharmacists, and attending to those that are 65 plus once we feel like we've finished the focus on the 80 plus. So.
And so maybe not so much for this week, but looking ahead, maybe a few weeks when we do have more doses available. Someone was wanting to know, what is the formula or the breakout for how many doses go to the healthcare systems? How do you figure both what percentage of yours is going to go to them, and then maybe each one, how many they get?
Right. So first of all, to the point of correction there is the vaccine that's coming is the vaccine for the entire county. I really don't want people thinking that it's because it's coming to the health department that it belongs to the health department. That is inaccurate. You will recollect that when this started, vaccines were going directly to hospitals. They were going directly to FQHC, like Health Partnership, and some to us. And so we asked to have better control over the flow of what's coming to the county. And that's why it's been distributed through us. So that's the first thing to keep in mind. And what we do depends on the situation. We look at a lot of data. Last week, we had to do a lot of second doses in our 80 plus group. So prior to canceling Tuesday, we had Tuesday, Wednesday, Thursday, Friday booked for second doses in our 80 plus group. And we were going to vaccinate at 1,400 a day. That was about 5,600 at the minimum. But we know that ideally, normally we do about 6,000 in those clinics at the end of the week. So we did not have a lot of room for first doses last week. So a lot of our vaccines went to our our partners to give out the first doses. This week, we did not have that many second doses to give, but we also have to wanted to finish all the 80 plus on our list. So we are retaining a lot of the second doses more than we did last week. So those are the factors those are the things that factor into those decision making. Ideally for us, though, we want to give out. We know that there are some that are not affiliated with health systems, and we want them to be able to come to us to get the vaccine. But we also want those that are affiliated with the health systems to be able to get their vaccine from the health system. So it's going to be a combined effort, collaborative effort as we move forward. But those are some examples of what goes into decisions about vaccine distribution. There will be time when some of the health systems have a lot of second doses to give, and they may not have as much capacity to give first dose. And we're going to make sure that we're aware of that and distribute accordingly.
We have a couple questions about grocery store workers, where they are in the process and when grocery store workers might start having vaccinations available to them.
So grocery store workers are also in phase 2 tier 1. And there could be some that are receiving, I would think those are very, very small through maybe health partnership or some of the pharmacies. That would be very, very few. That's just some of the word that we've had. And so they are in phase 2 tier 1. However, our current focus is to finish 65 plus, finish educators K through 12, and finish our childcare workers. The other thing that to keep in mind is by the time Children Mercy vaccinate our childcare, a portion of our childcare workers next week will be pretty close to 50% of those that have indicated interest. Is that correct, Elizabeth? And so we're moving through them. And so once we feel comfortable with our 65 plus, then we would shift some of the resources to grocery store workers as well as other persons in phase 2. There's some pretty significant persons or groups that are in phase 2. We've got our developmental services there, and all those are those congregate settings. All those are pretty significant and important groups that needs to be vaccinated as quickly as possible. So, but there are no groups that's as large as the 95,000 is the 65 plus group, and the 25,000 in the K through 12 and childcare combined could be as many as 120,000. Once we go through that, those other remaining are slightly smaller groups, and our expectation is we're going to be able to move through those groups quicker than we have done through this large group.
Great, thank you. We had a question about second doses. Again, this is kind of a specific question, so you might want to talk more broadly, but when are we opening up appointments for second doses of Pfizer on Thursday? So maybe this is someone that maybe is due on Thursday, or they feel like they're getting close. I guess maybe just talk where we are on second doses, timing wise.
Right, so we would open up second doses sometimes next week. I don't have all the details yet. This week, the second doses for tomorrow and Wednesday are for 80 plus, and our Thursday and Friday clinics are for 80 plus first dose. Now, the thing to keep in mind, like as we say every time, is you don't have to get the Pfizer vaccine at exactly 21 days after you get the first dose, or the Moderna 28 days after you get that. You have 42 days from the time that you get your first dose. And that's actually just going by the current CDC guidelines. Other parts of the world are doing first dose for longer periods, and there's no evidence of any adverse consequence for the actually some evidence points to even better immunity, but you do need your second dose. And your question is when. We are going to open up appointments for second dose, and just be on the lookout for the appointment, and then book an appointment, and you get your vaccine. But there's no need to panic. They will open up. Typically, we have your second dose here. It's just a question of the logistics of scheduling first and second doses. So when we open that up, that information will be disseminated.
We have someone who has made it's not really a question, it's more of an observation that people that have serious medical conditions but are not 65, they're under the age of 65, they aren't eligible right now, and maybe talk through how that was decided and kind of who made that decision.
Elizabeth, you take that.
All right. So the large groups and where they fall in each of the phases actually was made by the state of Kansas, so KDHE, and their work group. And so individuals who are younger than 65 with various medical conditions fall in phases 3 and 4. And so KDHE has said that within the phase, we are allowed to prioritize. So that's why this very large phase 2, which has 65 and up, and childcare and grocery workers and congregate settings, JCDHE has been able to prioritize even within that phase. However, we are not allowed to move people from one phase to another. So that means that people who are under 65 but do not fall into one of those key sectors, we can't bump them up into phase 2, even with pre-existing conditions. So we really have to abide by what KDHE has laid out. And my understanding is KDHE has separated out the different medical conditions between phases 3 and 4. And that's based on data and science, looking at who really is at an increased risk for severe complications of COVID-19. And so for additional information, you can go to kdheks.gov, or you can also visit our website at jocogov.org/coronavirus and look at the different phases and where each of those falls in.
Well, I think there was a lot of good information shared today, and just some good news, so that felt good to hear. Dr. Ariola, Elizabeth, any closing remarks before we sign off for today?
So there's we are very excited about the extra doses that we get. Again, I think last week Elizabeth was talking through our projection of when we think we'll be done with that. I think that timeline can be moved up a little bit based on that, and that's good news. Again, for every one of this group that we feel, you cannot completely say that you finished that group, because there are going to be people that are changing their minds or that are missed, but we're going to be able to say that we've walked through a large chunk of those people that have signified interest, and so that's a good thing. We're excited that our efforts in our schools and long-term care facilities are paying dividends. We continue to tell people to exercise extreme caution. Wearing masks and all of the other mitigation steps are very important. We still have not vaccinated 10% of our population. We are aware that a certain percentage have natural immunity from infection. But we can't rely on that, at least not yet. So we have a long way to go. And so we continue to ask our residents to be patient. Again, next week, our appointments will be open to the 65 plus group. And so there's been a lot of question as to why we focus on the 80 plus. So from Wednesday, it will be 65 plus, and we're now going to further stratify within that group. So again, it's not a lot of appointments, because there's a limit to the number of vaccine that we're getting, but we're going to be moving through and vaccinating as much as we can between us and our other partners. So thank you for your patience, and thank you for your understanding.
And Elizabeth, anything else you'd like to say before we wrap up for today?
No, just, I think that with the decreasing cases that we're seeing in our community, the warmer weather, just remember that COVID-19 is still circulating in our community, that anytime you gather with people outside your household, you're putting yourself at risk. So please continue to mask and do those really important measures that we've been sort of talking about for almost the last year now. So wear your mask, wash your hands, keep your distance. Those are all still really important, even as we see declining cases, because it's still quite a bit higher than it was, in the late summer, sort of or early summer before we saw that spike around July 4th. So keep doing all the things. But I think that there's definitely some good news and some light at the end of the tunnel. So.
Great. Well, thank you so much, Elizabeth. Thank you, Dr. Ariola. Thank you, Allison, for being here today. Again, thanks to those who watch on Facebook and ask questions and engage on this topic. And we look forward to seeing you back here tomorrow. So thanks so much, and everybody enjoy the rest of your day.